Not knowing that my water is not safe puts the stress on us, and we can't really take care of ourselves in the long run, not knowing what we're putting in our bodies.
The studies keep coming out that the water, the pipes are old, there's lead everywhere.
In the summer of 2024, the Water Collaborative set out to collect water samples across New Orleans to better understand lead and copper levels in residential drinking water. Our water is sourced from the Mississippi River and is managed by the Sewerage and Water Board of New Orleans. Given our city's long history, it's no surprise that our underground infrastructure is aging. As treated water passes through these existing lead service lines, it can pick up lead particles along the way. Identifying which of these lines contain lead requires substantial resources and coordination. We embarked on this process because we saw a lack of public engagement and transparency around lead contamination in water. Our goal was to explore what a more community-focused approach could achieve.
So was there lead found in my water? Yes, there was lead found in my water, which according to the Environmental Protection Agency, that is in fact a healthy level.
There was not lead found in the home I currently live in. However, I grew up in those homes, and I drank that water, and I know lead doesn't go anywhere. If it's malleable, it flicks off, it's in your body. It's in your body.
So I got an email with my results, and I was nervous about reading it because I figured there's a good chance that there was lead in the water living in New Orleans. And the results showed, in fact, it was above the federal limits. One was 17, so I'm like, oh, not so bad. And the other was 25. Am I an outlier? Am I really high? Is that sort of the norm? Federal limits are based on what? You know, does it affect your immunity? Do I tell guests, I can't serve tap water again, right?
The action level exceedance for lead in water is 15 micrograms per liter, or ppb. This is not a health-based standard. This is a trigger value, which triggers the utility to investigate what the situation is. And nationally, it helps the EPA to prioritize the cities that might need more support.
Started buying Ozarka bottles of water and then moved on to Kentwood, having a Kentwood machine, so getting bottled water delivered, so I don't drink the tap water. And in terms of the cost, it's about $100, $120, and that gives you about 4 or 5 5-gallon bottles every 2 weeks. And we use every last drop.
I mean, reading it and then just walking around, and then how many times do you turn the faucet on to brush your teeth, to drink water in the middle of the night, to make coffee, to boil pasta? And I did the research that boiling it isn't enough for lead. So it's really don't use any of the water, and that's almost impossible.
Water regulation is not perfect. It's not all-encompassing. We have to be more vigilant about protecting our own households, our own families, and there are ways to do that. These lead-certified water treatment systems that work at the pipe or as a pitcher that you can put in your refrigerator, and it will reduce your lead intake considerably.
My youngest sister, when she was young, at our house living on South Salcedo, it was in a paint, and being a child, she ate lead. From that point on, she actually did not excel academically as her other siblings did. She suffered a lot from asthma, skin conditions, and sorts like that.
I think about first my own child, and the fact that if I allow her to drink the tap water, that it could lead to different neurological or other health issues. Maybe that's why she's so tired all the time, because she takes a shower in that water. All of those things kind of cross my mind in trying to make sure that am I making good decisions for her.
We need to educate our healthcare providers about this issue to keep it at the forefront of our conversations, because it's still an issue. It will always be an issue because it's a metal. And what do we know about metals? They stay in the environment forever. Even the lowest amounts of lead that we intake, has an effect. It has an effect on our cognitive abilities. It has an effect on our children's neurodevelopment. It has an effect on their behaviors. It affects how well they do in school, their social behavior. Now, when we start aging, or we get stressed out, or we get pregnant, that lead will leach back up, and it goes right back into our bloodstream. So we have this inner source now of lead, and we keep re-exposing ourselves to it. You may be a child exposed to lead, but you're going to carry that lead with you throughout your life, into your reproductive age.
After Katrina, I had opportunity to do plumbing work. We renovated a lot of homes in New Orleans. I came across a lot of lead. We had to replace a lot of main line from the water meter to the home. And so when we have to connect to the service line, that was a lead line we connected to.
Utility companies often dismissed lead in water as a non-issue. Even pediatricians that I talked to really didn't think lead was a problem anymore. Unfortunately, in New Orleans, we have a very high risk for lead exposure. It's in our soil, it's in our paint, because we are an old city, have old homes, and we also have a lot of lead service lines.
I would say any single person living in the city should make an effort to have their water tested for lead.
Working with the Water Collaborative has been extremely positive.
They communicated with me when to use the water, to let it stand for about 10 hours. They came, they got the water, they left, and then I got the results in a timely fashion.
I was able to get a free water filter afterwards, which I use to the day, and my dog can have filtered water now. Yeah, so I think that was a great plus being part of the program, and I feel even better.
At the Water Collaborative, we collected 286 water samples from 144 homes across Orleans Parish, testing for both lead and copper. While none of the copper levels exceeded federal limits, 83% of the samples collected had detectable levels of lead. Of these, 15 samples from 11 households surpassed the current federal lead action level of 15 parts per billion. Since no amount of lead is considered safe for consumption, all levels of exposure should be addressed to protect community health. Now that we have this crucial data, it's time to take meaningful action. Our mission continues as we advocate for increased funding, full lead service line replacements, and widespread public education. Together, we can create lasting change and protect the health and well-being of our community. To stay connected, you can find us at nolawater.org.